Today on the Forgiven Nutritionist podcast, I'm talking with Tony Strong. Tony Strong is a seasoned professional with over 15 years of experience in the health and wellness industry. As a coach and a counselor specializing in sports, recovery, and nutrition, Tony has worked closely with doctors, chiropractors, holistic practitioners, gaining valuable insights into holistic health practices. Currently, he's serving the head of technical services at Strong Wellness Hyperbaric Solutions. Tony leverages his wealth of knowledge to assist clients with a deep understanding of the hyperbaric industry. He's known as a trusted expert who excels at educating and empowering individuals on their path to improving quality of life. As a proficient public speaker and host of various programs, Tony captivates his audience with his expertise and passion for promoting holistic well-being. His dedication and commitment to sharing valuable insights make him a respected figure in the health and wellness arena. Here's a clip from today's show.
The point is that we're starting to see the research, and even though that prescription might be for something that's off-label or something that is hard to diagnose, such as I'm taking it because of inflammation, or I'm taking it because of a traumatic a brain injury, a TBI that I might have had, or I might be a former athlete and I'm having negative consequences in my life because of predisposed concussions or these types of things. How do you repair that, right? Well, here's what we know. And we know that when you give the body what it needs, the body knows exactly what to do with it. We are an amazing machine. We are created in fundamentally most awesome fashion after our creator. I'll just go ahead and say that. But the body knows what to do with it. And so when you give the body resources, it's amazing what we see as an outcome. So more and more and more, we're starting to see these studies going, soldiers from Iraq having tremendous results using hyperbaric oxygen, mothers of autistic children who completely were non-responsive, non-verbal, incommunicative, using this modality.
Hey everyone, just a quick break to show some gratitude to our sponsors and give you some special deals. BrainMD nutraceuticals are high-quality supplements specifically designed to support and enhance brain health. Developed by Dr. Daniel Amen and his team of experts, these supplements use carefully selected ingredients backed by scientific research to promote cognitive function, mood stability, and overall mental wellness. BrainMD's commitment to purity and efficacy assures that their supplements provide targeted nutrition for the optimal brain performance and long-term brain health. Be sure to click my link in the show notes. Thank you so much for being on today, Tony.
Hello, how are you?
I'm good. So I'm a little bit familiar with you, but why don't you tell my listeners a little bit about yourself and what you did before, what you're doing, and maybe how you ended up in hyperbaric oxygen.
Great, thanks. Well, my name is Tony. I am the technical services lead over here at strongwellness.com. And I work for a small team of dedicated professionals helping to bring wellness back to the world. And we're doing it really one life at a time. So with regards to hyperbarics and the specific modality, did you want me to tell my story of why hyperbarics became so prevalent in our lives and why we're so passionate about it?
Yeah, that would be great.
Well, it's a COVID related story. So back in about 2020, right when the world was locking down and nobody knew what COVID was, I already had it. I was coming off a trade show and it was a whole bunch of people from overseas. It was in Rochester, New York, and there were a number of professionals there, and I also work in the audiovisual industry, so we're talking screen manufacturers from China and also Japan and Panasonic, NEC, the whole gamut. So I came home and I thought I had a cold, and the cold progressed to a sinus infection, then a lung infection, and I couldn't breathe. I went to the doctor, they couldn't help me. So I am literally on the couch going on 2 weeks, thinking that I'm just beyond it. I'm nothing but forgive the French, but a bleeding snot mess, and I can't get any better. And I just keep getting more. The mucus is going into the lungs, coughing up and going back into the head. The pressure behind my eyes and sinuses was so incredible. I could not relieve the pain. And a friend of mine said, hey, I have this thing. It's called Hyperbarics. Would you give it a try? And I'm like, okay, at this point, I'll try anything. So he brought over a hyperbaric chamber. He set it up in my basement and said, here's what I want you to do. I'll put you in there. You're going to sit in there for an hour, hour and a half a day, bring your movie in there, do emails on your phone, whatever. And I said, okay, well, great. We'll give it a try. And within the first 90 minutes, immediately, because of the pressure, my sinuses drained, my head started to clear up. Within about a day and a half, my lungs started to clear, and I was able to, express all those nasty fluids that you get when you have a sinus infection. And my ear infection started to minimize, and within about 3 days, I was able to fly. So this really got our attention. And I'm thinking, oh my goodness, why is it that I don't know about this? And so, long story short, my wife she's a business builder on her own, right? On her own right, as CEO, she said, this is what we're going to do. And we started strongwellness.com. We already had the name. We've been in the world of nutrition and helping doctors and homeopaths for a number of years, but Hyperbarics now became the super passion of our lives. And we've seen so much health recovery, so many lives restored, that it really is impactful to just be able to give people wellness back. And so we bring that wellness back home.
Yeah. Well, and you and I were just talking a little bit ago, and before I really got in the space that I'm in now, I mean, I'd heard of hyperbaric, but I hadn't really heard about it until I started working for the Amen clinics. And I see that we refer people out for that all the time. But then when I had my own SPECT scan and I found out that I have traumatic brain injury, which confirms a lot of things, and that's one of the number one things that they suggest and highly recommend for traumatic brain injury is hyperbaric oxygen. That's when it really, I think the light bulb moment for me kind of clicked, because now I'm involved. Okay, what do I need to do? And how do I fix it? And so that's when I really started paying attention. So unfortunately, I don't think enough people know about hyperbaric oxygen therapy, as well as a bunch of other brain helping modalities, but definitely I don't think they know enough about, we call it HBOT. So yeah, why don't you tell us a little bit, like, what is hyperbaric oxygen therapy? Maybe that'll give a good beginning point.
So from an overview for any of our listeners that may be new or people that might be very familiar with it, hyperbaric oxygen therapy, or hyperbaric oxygen therapy, HBOT, really refers to a modality that puts an individual inside a pressurized chamber. And the chambers can take lots of different sizes. Some are as big as a bus. Some are, you sit in one and you wear it as a cape over your head. So I don't know about that one, but the ones that are effective are a tube, a vinyl tube, and you go inside like a big sleeping bag, and you are in this tent, and we'll show you a picture of it later. But then that tent is brought up to a atmospheric pressure of 4.4 psi, or 1.3 atmospheres. And if you think about how a listener could identify that, it's about like if you've been on a diving board and you've swam down to the bottom of a swimming pool, that's about 1.5 atmospheres, or as far as how much pressure you would feel inside an oxygen hyperbaric chamber. And so you might notice some pressure on your ears. You might notice that it's you're holding air in your lungs and there's pressure now in your lungs. So that hyperbaric oxygen chamber, now filled also with supplemental oxygen, helps to deliver oxygen to the tissues of the body even better and more efficiently than just the lungs can, just by normally breathing. When you breathe in oxygen from the atmosphere, and that populates, if you will, from no better word, saturates your red blood cells through the lungs, and that carries that through your bloodstream to the tissues of the body. Well, when you use pressure now, that oxygen gets to be dissolved oxygen, not only for the red blood cells, but also into the plasma, the very plasma that saturates around and carries the red blood cells to where they want to be. So now we're delivering oxygen to capillaries that may either possibly be damaged. A post-traumatic stress disorder has broken vessels in the brain, other blood vessels from trauma, diabetes, chronic inflammation. These things can block the flow of oxygen to those areas. And so hyperbaric oxygen therapy delivers oxygen to the body in an efficient manner that the body understands and knows what to do with. and it helps to augment the oxygen that you're already getting in your lungs. Sorry, that might have been a bit long.
No, that's perfect. No, and I think that some people, you mentioned diabetes. When you mentioned hyperbaric oxygen, that's mainly when you look or Google hyperbaric oxygen, that's what a lot of people, I think, kind of associate it with, because it's used very commonly. It's commonplace for it to be used for wound care, because it does deliver oxygen. So it helps new cells, like you said, regenerate and repopulate. And that's what happens when you have a wound or a cut. And especially when you have diabetes, you get a lot of, unfortunately, you can get a lot of wounds, especially around your feet and hands. So I think that's possibly what people may be kind of familiar with, but I don't think that they're familiar with it for a lot of other health concerns and things like that either.
When we have tissue damage and we're looking at wound repair, the body's job is to create new healthy cells, right? Mm-hmm. So how is it that the body does that function of creating new, happy, healthy cells? Well, first of all, you have to have nutrition in place, that the body has resources like calcium, selenium, chromium, copper, iron, zinc. All of those vital minerals are there. Plus, what do you need? The missing word? O2, oxygen. It's the magic carrier that helps bind all molecules together, right? And when we're talking about health and wellness, oxygen can help you to repair healthy cellular tissue at the molecular level. So if I know that I could assist in that process to rebuild a bone marrow, skin grafts after surgery repair. I had a friend who just had a bypass surgery, and he's got a scar, literally from here to here where they cracked his chest open. And if you know that being in a hyperbaric oxygen chamber could deliver healing nutritive factors to those wounds, why wouldn't you want to investigate it?
Yeah, and I think that you hit a little bit of nail on the head too when you mentioned how, especially when you couple that with good nutrition and good lifestyle, that probably definitely helps accentuate the healing process a little bit faster than if you were just to do the hyperbaric oxygen chamber.
Right. Well, we know that the human body is a miraculous creation, and we're turning over, and forgive me, I don't know the number, but some 120 million different cells a day, right? So 20 million or 120 million, don't quote me on the number, but the emphasis is on the fact that we're trading dead cells for new live cells all the time. And that isn't only happening here in the brain, but it's happening in the heart, in the tissues of your muscular structure, the way that the body uses energy and gets rid of lactic acid and then has to recreate new energy. So the point being is that those new cells are being recreated all the time. And so if I know that I'm injured in some way, I've got a wound, I've got some kind of chronic problem, I have inflammation, which is one of the primary uses, if no other use at all, for hyperbaric oxygen therapy, is that it is documented to reduce inflammation. So when you're looking at how do we recover as a sports professional or performance athlete, as somebody who's coming off an injury, or as somebody who's had a surgery, or somebody that has a chronic illness such as PTSD or neurological function damage. We've seen great strides in autism recovery from use of this modality. Why wouldn't you want to investigate it? And I was struck with the same thing. I was a little bit angry at it. Why don't I know about this as a professional in the industry? Hyperbarics, I thought, well, Michael Jackson has one and he sleeps in it, but nobody really knew what it was 20 years ago when he was using it for, aging. And remember all the surgeries he likely had, so probably for helping to repair his tissue at that level. Anthony Perkins, Tony Robbins has one that he travels with. So I don't know if I migrated off the point, but the point you, I think, wanted to draw back to was when the body's creating new cells, it's really important to have oxygen on hand, and a hyperbaric chamber can help deliver that supplemental oxygen so that people can repair.
So about 35 years or so, I struggled at least with depression and anxiety. And never once did anyone look at my brain or want to figure out what was going on in the brain. They just wanted to medicate, which is this traditional standard medical way of caring for a patient, unfortunately. And rather than using some other modalities like hyperbaric oxygen, when they could have looked at my brain and saw that I had traumatic brain injury, and that could have been addressed long ago as well. So hopefully people are really taking pause and thinking, okay, what can I be doing, or could this possibly benefit me or someone that I know? Maybe they know, are immediately thinking of somebody that they know too. That's a lot happens.
Right on. And I think it really leads to this area. And we talk to people about this all the time. You need to be responsible to be your own health advocate. And I'm not saying that doctors don't know what they're talking about. I'm not saying that medication is bad. No, absolutely. They all has a place, and it's designed to work together. But we have to also be responsible to be an active participant. So if I know that I've got some type of a chronic ailment and I play victim and just go to the doctor and I say, doctor, I've got this symptom. And the doctor says, okay, take this pill that addresses this symptom. Me as the patient, have I solved my problem? The point is that we need to be our own health advocates.
Yes.
And we need to be responsible for gaining some of our own information and helping our practitioners with that information, and not just blindly seeking the pharmacological approach, which is the easy answer. Right. And I think, well, you might agree as a nutritionist, not all pharmacological interventions are really in our best interest. Great. I know medicine is good. We have to when it comes time, but there's also a piece of responsibility that resides on us, the patient, and also us, the practitioners, right, as recommending healthy solutions to people, to consider the fact that possibly all pharma is not in our best interest.
Right. And unfortunately, I don't think enough providers share the negative side effects. They just trust their provider that they know what they're doing. And I don't think the providers fully know the full gamut of all the side effects that really do happen. You know, we're programmed to see the commercials on TV where the people are still running with their dog and think, oh, I want to run with my dog on the beach again. But, you know, meanwhile, they're telling these list of unfortunate side effects that really do happen. And I think we're also programmed now to overlook that because we see the people running on their beach with their dog and having a picnic with their family.
Well, and the legal department has required that they actually say these things, but they're putting in contrast happy faces and grandchildren being hugged and, you know, let me take this pill and I'll be able to walk again, or I'll be able to, you know, wake up in the morning, or I'll be able to ambient myself to sleep on a perfect night. But, the truth is that we need to take responsibility, and it might be that there is an alternative approach that can give you better or longer lasting results than that pill might. So you just need to take that into a consideration.
Yeah, unfortunately, like I mentioned before, I'm in the middle of going through a struggle right now. We'll call it a struggle. Because I'm trying to get as much of my hyperbaric oxygen chamber covered as possible through my insurance. But because I don't have diabetes and I don't have, diabetic wounds, I have to jump through all these extra hoops to possibly get some coverage. Before I try to then pay for it out of pocket myself, which I may end up just having to do. But I'd rather try to get some kind of coverage. And I think it's really unfortunate that people have to go through something like that when they're already experiencing some struggles, and especially when you have mental health conditions. Luckily, although my husband may differ, mental health capacity is on point most days. It's not that way for everybody all the time. Sometimes people it's a struggle just to get up and put a load of laundry in, let alone contact your insurance company or a provider for this. And so, yeah, it's hopefully one day there'll be better coverage for some of these actual real good care that can really help people and make a difference.
Yes. When it comes to hyperbaric oxygen therapy and getting coverage, you do need a prescription for this, because the hyperbaric chamber is a class 2 medical device. And whether you've got a soft shell or a hard shell, you do need a prescription for that. But I think the bottom line here is that when we start to use these modalities and start to see results, more and more acceptance is gained from the medical community. For example, you now can go to the NIH, the National Institute of Health's Library of Medicine, right? And we use this tool all the time. You can just type in HBOT at the top of the search bar, and you can see the litany of different types of actual studies that have been done. And and again, you kind of got to take it with a grain of salt because not all studies are fully scoped or managed as far as having the correct amount of applicants in the study. Some of them have a very narrow scope, and some of them are strictly out there just to disprove one fact or other. But the point is that we're starting to see the research, and even though that prescription might be for something that's off-label or something that is hard to diagnose, such as I'm taking it because of inflammation, or I'm taking it because of a traumatic a brain injury, a TBI that I might have had, or I might be a former athlete and I'm having negative consequences in my life because of predisposed concussions or these types of things. How do you repair that, right? Well, here's what we know. We know that when you give the body what it needs, the body knows exactly what to do with it. We are an amazing machine. We are created in fundamentally most awesome fashion after our creator. I'll just go ahead and say that. But the body knows what to do with it. And so when you give the body resources, it's amazing what we see as an outcome. So more and more and more, we're starting to see these studies going, soldiers from Iraq having tremendous results using hyperbaric oxygen, mothers of autistic children who completely were non-responsive, nonverbal, incommunicative, using this modality, which is what we call off-label, right? It's not something that's specified, like you mentioned, like a surgery wound or the bends or a diabetic recovery. Those things are on label, and there's a small list from the FDA of what is in clinic label. Those are covered by insurance, but anything else you might struggle with getting coverage. But seeing tremendous results in that regard. So great point. Does Medicare coverage cover it? Well, sometimes it depends on the code that the doctor uses when they fill out the insurance form. So if that medical clinic or that doctor provider that's recommending hyperbaric oxygen therapy, if they are also a solutions or a services provider, they have a code that you can use for Medicare that helps to augment that cost, and the coverage of the chamber can be covered by Medicare. Where ourselves, we are a equipment provider, right? So we're providing hardware and equipment solutions. We don't have that kind of Medicare number. So if you know who your clinical provider is, and if they are able to use a services description in the code that they recommend when you're doing your hyperbarics, then sometimes that can be covered.
That's a great tip. Hopefully people caught that. And if they're driving, hopefully they'll rewind the podcast and listen to this portion of it, because that may help them or some of their loved ones, really,
Yeah, and so it's about off-label or on-label, and we know that hyperbarics can be used for lots of uses that are off-label. And if I can expand on that, I know why. Some of us have chronic conditions. Some of us have temporary conditions. For example, I've had a surgery, right? It has a beginning spot and it has an end spot. And I can go and get hyperbaric treatments. I can go to a clinic. I can see somebody, but those treatment sessions will have an end. But now if you talk about some of the things we've mentioned, such as depression, such as traumatic brain injury, such as some of the things in autism spectrum disorder, these things do not have a beginning and not have an end. So the question is, can you use something we know that down regulates inflammation, up regulates mitochondria condition effect, up regulates oxygenation and helps to detoxify the body, up regulates stem cell production. If we know that the technology does that, just because it doesn't say on an FDA approved label that you can use this to help support the effects of PTSD or ADHD or some of these other things, doesn't mean that it won't be effective in there. We know everyone is genomally different. My results are going to be different than your results. Mm-hmm. So, but the fact is, we know that these clinical things remain, right? So while we at strongwellness.com say we do not treat, cure, or prevent any disease, again, we got to be very, very clear what the FDA says. As a nutritionist, because I'm taking calcium, magnesium, or I'm taking glucosamine, chondroitin, and MSM for my joint pain, or I'm trying to combat the symptoms of MS because it's getting difficult to walk, and I know that these nutrients can help that. You can't say, according to the pharmacological world out there, that we treat, cure, or prevent any disease. So we make that very clear up front. We do not treat, cure, or prevent any disease. We give people the ability to support body function in a way that the body knows what to do with.
Yeah, and I think you made a great point when you said that earlier, because that's one of the things that tell my clients or just people in general is that the body can heal and the body can work. But again, we have to give it what it needs. And unfortunately, years ago, before I changed my diet and lifestyle, I was not giving it anything, literally not one thing that it needed.
Taking away more.
Yeah. I mean, and so your body is designed to, it literally tries to keep you alive and keep you going well. And it keeps you at, they call it homeostasis, which is like that beautiful, happy line. But when it's struggling, it can only, it's like that water line. And before you know it, you're going to be underwater. And if you keep not giving it what it's supposed to have, you're going to keep going down and down and down. And it's going to try its best to keep you up there at that beautiful water line. So you got everything you need, but it just doesn't work.
And what happens when that water line goes down and down and down? We realize that, oh my gosh, there's oxidative stress on the edge of the tub. And I can see exactly how far down my healthy spot used to be. And now I'm down here, revealing all of this nasty brown scunge that's around the edge of the tub. And you know what that is? That's toxicity. That's lack of sleep. That's lack of nutrition. It's poor diet. It's lack of exercise. It's not exercising your brain, giving yourself healthy brain things. And, like any muscle, when you stop using it, it starts to degrade.
Yeah, absolutely. Absolutely. And I was not giving any of my muscles any love either many years ago too. That was another thing I was neglecting. So what can like a patient or somebody who's going to go through hyperbaric or have been told that they should, or they're thinking maybe I could use this, what can they expect to happen during a session?
So we've got a number of videos that are available on our website, and I don't know if you have the ability to play one, but there's a couple of orientation things that we run through with clients. Number one is you'll be going into a chamber, so dress comfortably, your sweats. You can have pillows and all those types of things in there. And with mild hyperbarics, you can bring in your device. So if you want to answer emails, or if you've got they call it intrinsically safe device, which means that I'm not going to bring this into a room full of fumes and this device won't blow it up, right? So intrinsically safe devices are solid state by nature. That's tablets, phones, earbuds, these types of things, intrinsically safe. And you can use these in the chamber and to pass the time and just make the session go a little bit more smoothly. The chamber will pump up, so you may have some sensation on your ear. As we mentioned, that diving into the pool, right? The deeper in the water you get, you feel the sensation on your ears, right? And if you've ever been a scuba diver or you're familiar with scuba diving, they teach you how to clear your mask and then how to equalize the pressure in your ears. So a scuba diver, as he's going down to atmosphere after atmosphere underwater, that pressure on his body and the pressure on the eardrums, the tympanic membrane, is going to increase. And so to equalize that pressure, you need to equalize the pressure inside the sinuses with the pressure that's outside the air. And that's achieved by simply just holding your nose and breathing briefly. And you feel your ears pop. You ever been on an airplane?
I have, yes.
Have you ever felt your ears pop on the airplane?
There have been times, yes, but I find myself, like, just as you were explaining that, I found myself naturally just doing it automatically, even though I wasn't having
I try to yawn, right? So this is the sensation that we would experience when the body is undergoing a change in pressure. Naturally, the air inside the sinuses needs to equal the air outside. Otherwise, we might feel this pressure. So on an airplane, I try to yawn, I crack my ears, and then my ears pop, and then everything gets loud for a second, and then it acclimates, right? But these are the types of things you might experience inside a chamber when you're doing a session. Otherwise, once the ears are equaled and you're at pressure, it's just a comfy hour and a half little nap time. And, I might get through my favorite Netflix episode or something, but very comfortable, very convenient.
Well, did you want to try to pull up that video now?
I do have a video. Let me see if I can share my screen.
That would be great.
And if I'm able to share my screen, let me see if I can't do that.
And the listener will just have to watch this later on, this portion of the video later, when they are not driving or in a safe area.
So I'm going to share this video. Hopefully the audio will come through as well. And it's about 5 minutes.
Hello. and welcome to your new patient orientation to hyperbaric oxygen therapy, or HBOT. I'm so glad you've decided to explore this innovative and highly beneficial treatment option. HBOT is a medical treatment that involves breathing in concentrated oxygen while inside a pressurized chamber. This therapy has been found to be highly effective for a wide range of conditions, including traumatic brain injury, cognitive functions, stroke, chronic pain, and many more. The reason that HBOT, or hyperbaric oxygen therapy, is so effective is that it floods your body's tissues with oxygen, and it's under pressure, which helps to reduce inflammation and actually promote healing. Clinical studies have shown that HBOT can significantly improve a patient's symptoms for many different kinds of conditions, including brain injuries, infections, and even chronic diseases like multiple sclerosis, or more complicated and harder to diagnose neurological issues. One of the largest benefits of hyperbaric oxygen therapy is that it's found to reduce inflammation, which causes so many complications and compounds other health issues not diagnosed during an initial checkup. Today we'll be talking about mild hyperbarics, which operate at a little less atmospheric pressure for safety and efficacy concerns. Mild hyperbarics uses a soft-sided chamber as opposed to the higher pressure and more difficult to use hard-shell chamber. So, what are the top 3 reasons why you should consider starting hyperbaric oxygen therapy right now? First, it can help to speed up the healing process for a wide range of conditions. Second, it's safe and effective and non-invasive treatment option that doesn't involve drugs or surgery. And third, it can promote your overall quality of life by reducing pain, decreasing inflammation, improving mobility, and increasing your cognitive function. If you're considering HBOT, it's important to know that this therapy is backed by extensive clinical research. In fact, there have been many more than 10,000 published studies on hyperbaric oxygen therapy, which have found it to be a safe and effective treatment option for a wide variety of conditions. If you're going to receive HBOT in a clinical setting, you'll be carefully monitored by a team of trained medical professionals who will ensure that you receive the right dose of oxygen and that you're comfortable throughout the entire process. And if you're considering using an at-home HBOT chamber, we'll provide you with all of the guidance and support that you need to ensure that you're using it safely and effectively. While receiving your hyperbaric oxygen therapy treatment session, based on your individual treatment plan, wear comfortable clothes and be prepared to relax for maybe 60 to 90 minutes per session. Many ask if spending more time or using up multiple sessions in a day will help the treatments. Well, and the answer is yes, but with only a marginal increase in results. The most important part is to be consistent and regular in your treatment sessions to provide the healing support that the body needs. Be sure to consult your medical professional for any modifications or additions to your treatment plan. Much like being in an airplane, when receiving your treatments, try to relax as much as possible. Let your clinician know if you have any worries or concerns. Inside the chamber, you can bring your own pillows or blankets. You can use your own earbuds with a cell phone or a tablet, or bring your laptop just to pass the time. You're free to listen to soothing music, read a book, make phone calls, or just relax to your favorite movie. If you've got trouble making it to the clinic to get to your sessions, or maybe live too far away to make many visits practical, talk to your clinician or your administrator to learn about our other options for in-home use, home rentals, or our rent-to-own programs, which may be available. There's a group called strongwellness.com that helps us, and we're dedicated to giving you the information and support to make the best decisions possible for your health care. And they're committed to helping you get started with your own treatment plan. They'll walk you through the process, make sure you get the best plan for your in-home sessions. So, there you have it. An overview of hyperbaric oxygen therapy and its many benefits. If you're interested in learning more about HBOT or want to schedule a consultation, please don't hesitate to contact us here at the Amen Clinic. We're here to help you get the care you need to get back into body balance and live your very best life. Thank you for watching. and we look forward to working with you soon.
Yeah, it's a great way to kind of digest a very complex issue, give you some working visuals, help people understand kind of the ins and the outs of it. There are several clinical types of approaches, right? How do I know which is the best one? How do I know this one's going to work for me? If it worked for her, is it going to work for him? And so a lot of these questions we try to answer at strongwellness.com. Of course, we support that, the hyperbaric chambers with accessories, and we work a lot with coaching and helping people through the process. I have a loved one. They won't listen to me. Will they listen to you? And so we'll perform those kinds of things. And I'm sure you run into that in your side as well, right?
Yeah, it doesn't matter. Well, it's like your kid too. They'll gladly listen to, the parent that's telling them that's not telling them something. So they'll listen to dad if he's not the one telling him to do it, or they'll listen to the aunt or the uncle, that's telling them to do the same thing. But because it's mom telling you, that's always how it is, unfortunately.
Yeah,
especially
we
when
have
it's
that filter.
Yeah. Yeah.
Right. My husband always says, I've told you that for years, but as soon as one of your friends tells you, then you'll do it.
Yes,
like, well,
exactly.
Okay, I might be guilty of that once in a while.
So since you mentioned it, what should people be looking for when they're choosing a hyperbaric oxygen, either provider or to rent or purchase one themselves?
So there are many different ways that you can go. People call us all the time asking for used types of chambers. Every once in a while, we might have a unit that comes back in as used. We do have a small fleet of rental units, so it is possible to, call us up and say, "Hey, I'm just not convinced. I'm not sure that I can get my husband to go along with this, or my wife is, a bit skeptical. Will you help us get through this? Let's rent for a couple of months. We can do that." And for every purchase, we have a free forgiveness plan. It's a 2-week trial period. If you buy one, bring it home, you got 2 weeks to pack it up, send it back, no questions asked. So you're not out anything. So that's a safety concern. And when you look at the cost of shipping and renting, and you got to pay first month's, last month's security deposit, am I going to get an oxygen concentrator with it? All of these things tend to end up, you're almost at the purchase price of a chamber to go ahead and rent one. By the time you've rented it for 6 months, you should have just bought new, right? The other clinical factor is many times we go to a clinic or a service provider for these types of things, whether it's a clinician or maybe the Amen clinics. I know that they have chambers in some of their offices. It might not be practical for me to drive 2.5 hours to get an appointment. Or the appointment schedule might only be for Wednesday and it's now Tuesday and I've got free time and I really want to take a session now. Or, you know what, I work the night shift and nobody's available when I'm available. So I want one that I can be in the chamber at 2 to 3 in the morning is when I like to do it. So sometimes a home purchase just makes the best sense when either the clinician is too far away or there's too many sessions involved. That's going to mean that, well, if I'm going to commit to this, remember we talked about those no endpoint types of chronic things where if I wanted to pay for 90 sessions, great as a start. But if I'm looking at maybe using this thing consistently for a half a year or a year in order to recover from some type of traumatic injury that we've had earlier on in life, it may take that much in maintenance to be able to use this therapy and see the actual reproductive cells. They're little building blocks, right? And we're rebuilding this wall that was torn down years ago and it was bashed and the pieces are all laying down here and we're reassembling the cellular structure of that infrastructure that's going to support our lymphatic system or our muscular system or our bones or our teeth and ears and neurological function. All of that is a process, and that process takes time. So it might be that a home purchase is the best source for some of these. And gosh, you know what? They're super affordable.
Yeah. Are there any certifications or qualifications that people should look for, whether it be for a home purchase or rental or for when they go someplace, because anybody could possibly You want to make sure you go someplace with good quality experience.
Right. And we train all our clinicians to have the correct procedures and do the upfront stuff, the tools that they need to be able to administer these sessions. So whether it's a holistic practitioner or your chiropractor or whatever, how can you verify? And again, it's very, very difficult. There are certification programs that you can undergo. There is a Hyperbarics Association, and they have an annual, I want to say gala, but the annual event where practitioners and holistic people gather, and the topic is hyperbarics, and they do some certification courses there. And there are some certification courses that some of our clinicians have said, well, I'm going to go and fly across the country and in a 4-day week or whatever, get my hyperbarics certification, which prepares me for kind of all the ins and outs and how to answer and prepare people for visiting our clinic so that we have somebody that's actually certified on staff.
Oh, that's good to know, because I was actually unaware that there were those events as well. I mean, I know that hyperbaric oxygen shows up at a lot of conferences, and we'll call them trade shows, but I didn't know that there was an actual one just for hyperbarics. So that's good to know. That's great.
As a nutritionist, you've probably participated in like the beauty makeover show conference or the health and wellness expo and all these types of things where you might see somebody with hyperbarics. And it's nice to know that some of these professionals have actually been trained by real professionals. And there's the FDA concerns as well. So one of the things that I tell people specifically is watch out for devices coming from China. Because they are not FDA approved. Most of them, they haven't applied for the correct certifications. They don't have the aligned practices. The FDA has never visited their facility and proofed their production processes. The quality hasn't been overseen. So here in the U.S., we choose to work with the Summit to C-band, which is a completely FDA certified, and they're visited by the FDA. They have audits all the time. So China also can produce some chambers which are higher pressure. And one of the things that we talked about earlier in our dialogue was what's the difference between a mild hyperbarics and a higher pressure chamber? Well, I don't know if you want to get into that now, but some of these China-made chambers are being brought into the United States, and they are illegal to use because they're using a higher pressure in a mild form, and they haven't gone through the proper regulation and certification channels. So just be aware of that.
Well, and I think that some people get the idea, and I can be guilty of this as well, that sometimes you think, oh, I'm going to do more because that's probably going to be better, whether it's a supplement or in this case, hyperbaric. And sometimes that is not always the better way to go. Sometimes, they literally, like you said, doctors will literally prescribe a certain amount that you should have for whatever condition you have or what they think that you're able to withstand as well, too, because that can make a difference to your current health conditions, so you got to definitely make sure that you listen to your healthcare provider as far as what they write on that script, because you definitely want to follow those instructions too.
Yep. And here in the U.S., there are mainly two modalities. One is a mild hyperbaric chamber, and that operates at 1.3 ATA. That's the atmospheric pressure. That equals 4.4 PSI. There also is a hard shell chamber. Now, the hard shell chamber operates at 2 atmospheres. So that's the difference of being, compared with 12 feet underwater compared to being 32 feet underwater. So it's a higher degree of pressure. And those types of chambers, you need to be administered by a clinician. So you have to go somewhere like a hospital or a treatment center to get a hard shell chamber visit. And many times they're using bottled oxygen as the supplemental oxygen inside that chamber. So bottled oxygen, you might be familiar with, the little old lady in the park pulling behind her the green can on the 2 wheels, right? And she's wearing the little hose that goes here up her nose. Those hard shell chambers, because they're operating at pure oxygen, in other words, they're piping the chamber full of typically 99% pure oxygen. There's no ambient air. And B, they're under that higher pressure. There's a whole even fire code type of thing. Does a building have a sprinkler system? Does the place have the license to be able to certify patients coming in to use the hard shell chamber? So, and you can't use a hard shell chamber at home. because it's licensed for a manual clinician use. So you got to be monitored. There's got to be somebody on the outside, and it's got to be in a certified clinic. So those types of things can help you. Now people say, well, okay, let's do the math, right? If a little pressure is good, is more pressure better? And in some cases, depending on the individual, that answer might be absolutely yes. It might be that I get to my health goal result a little bit quicker using that higher shell chamber. But there's also a cost to that. Now I've got to visit a clinician. I've got to drive there. I've got to pay for those individual sessions. I don't own the actual equipment. I can't use it when I want. So I equate it like this to draw a picture. Which is better, Wendy? You tell me. A sports car, like a fine Corvette or a nice Porsche, or the minivan? Which is a better vehicle to get you from here to there to take you where you need to go?
Well, overall cost-wise, if we're just talking cost, I'm definitely going to go with the minivan. Yeah.
So the answer is it depends. It depends on your function, right?
Yeah.
The minivan might be a great grocery getter. It's great for hauling the kids. I could pack a whole soccer team in the back. It gets me from here to there, but just a little bit slower than maybe that sports car would. Now let's look at the sports car. It's cool. It's new. It's flashy. It's fast. It can take me from here to there in a fraction of the time of that minivan, but I sure can't get a car seat in the back. Right. And it's not very functional for putting my golf clubs in for going on the weekend. So as a multi-use utility vehicle for the function of getting between here to there, do they both work? Yeah. The answer is yes. And one gets you there faster, but one's a heck of a lot more expensive, and one's more functional, but you can use it a lot more for a lot more things. So that's sort of that picture I paint between the hard shell chamber where you go to a clinic visit and a mild shell chamber where either you go to a clinic visit or you might be able to own one for yourself at home. They both do a great job. One gets you from here to there with a little bit higher pressure, more oxygen. So I'm saturating the tissues with a little bit more oxygen. But if I'm using my at-home unit twice as much as I use that hard shell chamber, aren't you really equating the speed of diagnosis at that level? And the answer is sure. But again, it depends on the individual.
Right.
Did that answer that question? Was that pretty descriptive?
Yes. Well, and I feel like I say this in a lot of my podcast episodes too. And we live in this Amazon world where we want everything now. And sometimes your health doesn't work that way. You do need to go the longer, slower method, and it's going to be better for the long haul, even if it's weight loss, little bits at a time is going to be much more sustainable and keep off if you go longer. So sometimes it's better to go low and slow. Slow and steady wins the race. Isn't that what the turtle said? The tortoise?
Yeah, the turtle in the hare, right? Water is good for you, but too much water will kill you.
Exactly.
So you want to make sure you choose wisely.
So what are some side effects or risks that might be associated with hyperbaric oxygen? Because I think that's sometimes a big concern with people as well.
Excellent question. If you're like my sister, you're like, well, what could go wrong? Could it kill me? And the short answer is hyperbarics generally as a modality is considered safe. It's GRAS. It's a GRAS technology, generally regarded as safe. So that means it carries the same type of warning concerns that you would get with acetaminophen or ibuprofen. Now, that said, there are a couple of contraindications which absolutely should not use hyperbaric. If you've got any of the conditions like a collapsed lung, or you've got, I know there's a clinical term for it, it escapes me now, but it's if you've got air in between the inner and the outer pulmonary portions of the lung, absolutely do not use hyperbarics until you're able to get that piece fixed. That is an instant no contraindication. The other one is if you're unable to clear your ears, if your sinuses and your ear pressure are so bad that there's no way that you can pop the ear or do the Silva method where you gently blow into your closed nose and pop your ears, then you should not use the chamber. But other than that, whether I've got a head cold or an ear infection, we want to be careful of those. We need you to communicate with your clinician about what your symptoms are. And if you ever experience any kind of a pain in the chamber or something, if the pressure on the ears is too much, you use the pressure relief valve and you dump some of the air out of that chamber until the ears have a chance to equalize. And then you close that valve and then pressurize that chamber up the rest of the way. So really for contraindications, there's only a few.
Well, and when you said that clearing of the ear thing, last year I was bit by a tick, and my husband could tell you stories. It was awful. I mean, as we get older, we do start to lose some hearing. But I felt like my hearing loss went from a 2, maybe on a bad day a 3, to a 10 or an 11. Like it was like instantly overnight, and it did not stop for several months. And yeah, there was nothing that I could do to clear that. And it was the most awful experience. So that I would, if anybody is experiencing that from tick after having a tick bite, I would say, yeah, please don't use a hyperbaric oxygen chamber until now I can do it. And now it's fine. It's back to that 3. So it's not back to the 2/3. It's now down to a 3, but it's still a world of better than what it was. So
there's a few concerns there. You awfully soon you can go into the chamber and then again monitor that pressure increase. Again, if there's any pain or anything, you can stop the increase, clear that pain. If it doesn't clear, exit the chamber and wait a few days and then try again.
So if you could kind of debunk one myth about hyperbaric oxygen, what would it be?
Well, again, let me refer affectionately to my loving sister who claims it as voodoo science, right? And she said, well, I've never heard about this. Why, if it's this good, why haven't I heard about it? Well, there's a great answer to that question, and I'm sure a lot of people are clicking right now. There's a lot of real good solutions that have come out in the health and wellness industry that by one means or another, none of us have ever heard about. And there is an active, I don't want to say it like it's some kind of conspiracy theory, but the pharmacological approach to health and wellness in the United States is a machine. It's $1 billion industry, and they have an interest to protect. So is it any surprise that if there was a cure for diabetes back in the 60s, that some beautiful marketing agent didn't go ahead and buy that cure and then sit on it? If there was truly an engine that ran on water, isn't it true that there might be a fossil fuel executive who bought that technology and sat on it? So we've all heard of these examples before, and we know that there is some ring of truth to that. So with regard to hyperbarics, is it safe? I think we've covered that piece of it. But the piece of why haven't I heard about it before is because I think that there is a lot of disinformation and a lot of pro-pharmacological approach. The same person that's told by their doctor that they need a statin drug because their cholesterol is too high. Well, I have no symptoms, no cardiovascular history. I've got nothing other than the fact that I'm 58 years old and now I go to my clinic and you're telling me that I need to be on a statin drug. Well, there are side effects of that statin drug. That stops CoQ10 production in the body, which is its highest use in the lining of the stomach, protecting your acid from eating the stomach, and in the lining of the brain, protecting your neurological function. So many clinicians don't tell you when you take a statin drug, you should also supplement with a CoQ10, enzyme CoQ10. And that helps to support healthy brain and healthy lining of the gut. We know that the microbiomes now that you have in your gut, the positive flora content that are in your lower intestine, are largely responsible for your immune health. And so did they tell me about that when they were saying, hey, guess what? 20 years ago, margarine's great for you. It's an awesome solution. Well, now we know margarine is one molecule away from plastic, and it is absolutely hostile to the cardiovascular system. Try never to use margarine wherever possible. Or in the 40s, 50s, hey, my doctor smokes Pall Malls. Well, we don't even need to go there. But so is it voodoo science? And the significant research points to it is an effective modality for treating chronic types of conditions, not because it's good to treat the disease, but because it decreases inflammation, increases stem cell production, increases and upregulates mitochondria regulation of the cells. Those 3 things alone answer a lot of health concern.
Yeah, I would 100% agree. And, at the Amen clinics, we recommend it to people of all various ages. I mean, anyone from in their 30s to 77 and 80 years old. So I think that people are worried about their age too. Again, they're already checked out from a healthcare provider. If they're able to see it, maybe you can too. So yeah. Well, if you, I always like to ask my guests for their don't miss this moment. And if you could have one kind of really important takeaway, what would that be that you would want the listener to remember?
Well, I think that just because you haven't heard of hyperbarics or you don't see advertisements on TV doesn't mean that it's not an effective health strategy to cover a lot of things that aren't prescribed as health modalities. Again, we need to be our own best health coach. And if I knew that I could provide some type of support for one of my family members who struggles in this area or that area or the other, neurological function, highly beneficial. We see a lot of our best recovery stories coming from places like an Amen clinic, where people are seeking help. They're seeking solutions. And this is stuff that's not prescribed by their MD. They cannot get this type of advice and education from an MD. They're trained in a different college of medicine, if it were. So just be your own health advocate, and that would be my answer.
Well, that's great. So I will put some links in the show notes to that video as well as to your website. But why don't you tell my listeners where they can find you and maybe follow you guys or check out all your HBOTs?
Yep. So we're on LinkedIn. We're also have a YouTube channel. You can see a lot of our videos, like the one that we shared today on strongwellness.com on YouTube, and strongwellness.com from our website. You can go there and get information, see different styles and kinds of chambers, look at accessories. And we are a partner for many different types of clinics and healthcare facilities, like Amen clinics, for example. If you are prescribed HBOT, you might actually come to us and decide that you either want to rent or buy a home use chamber. So those are the types of things that we can help you with, and we'll be a great coach for you.
Well, great. Well, thank you again so much for being on today. I found it very enjoyable, and hopefully my listeners learned a few things, and maybe they'll take a few moments to pause and think about if it's not themselves, if it's somebody else, that maybe they could recommend HBOT to.
Yes. Thank you very much for the opportunity, Wendy. And we support you, and we support the Amen clinics, and let's all bring wellness back home.
Thank you.
Are you looking for a good probiotic? Seed DS1 Daily Synbiotic has both prebiotic and probiotic. It supports digestive health, heart health, skin health, and gut health, including those who suffer with IBS. Their products are clinically studied and third-party tested for quality, and I think you'll be impressed with their eco-friendly packaging. Click the link in the show notes and use my code FORGIVEN for 15% off your first month supply. If you want to continue learning and hearing all things nutrition for your mind, body, and soul, click like, subscribe, or favorite me on whatever podcast platform you use, or you can find me at ForgivenNutritionist.com. This podcast was designed to educate, inspire, and empower you to achieve your health and wellness goals. It is not meant to diagnose or treat any illness or medical condition or take the place of any treatments from your current healthcare providers.